So, Joy, how long have we known each other now?
5 years.
5?
Yes.
Oh my God.
Almost 5 years.
So we started treatment about 5 years ago?
Yes.
So I suppose we start at the end, and you're happy?
Oh, over the moon. Best thing I've ever had done.
Really? Made a difference to your life?
Oh gosh. Yes.
Wonderful.
Confidence, smiling at everyone. The night I had them, you completed, I took the mirror to bed.
Did you really?
Yes, I did that Saturday. Kept putting the lights on and having a look. I thought,
Wonderful.
Yeah.
So let's take you back to the very beginning. What was it that made you want to start having your teeth fixed? What was wrong with them?
I had no smile because they were so ugly. There were a lot of crowns which were loose. Overall, I didn't really live because I was afraid to talk to people and smile. Because
that's no good, is it?
No, that's no good. But you've made such a difference.
Okay, so how do you go from deciding that's what you need something done to coming to see us? How did you hear about us?
But actually, my own dentist gave me your name.
Okay.
And then I looked you up on.
So I remember when you first came to see us, it was just before Christmas, and you came to see me, perhaps once or twice. Then you had cold feet, didn't you?
Yes.
Well, what happened there? Was it me you weren't sure of, or was it the
No,
treatment? Because there was a lot of work.
Yes, the treatment, and probably going through the pain, which I didn't really.
Good. So, if you don't mind me saying what we did a little bit, so we started and we had to make you a denture.
Yes.
How did you cope with that?
I didn't, did I? Then you made me a training plate.
Okay.
Which was the best thing ever.
So what we went back, you hadn't worn a denture before.
Never.
And you started to wear it and couldn't wear it. So we made what was called a training plate, which is a clear acrylic base plate, which you wear for 5 minutes a day, and you build it up until you can wear it. And that made a difference.
A hell of a difference. Hell of a difference. Because I couldn't have put anything in my mouth like that. But doing as you told me, 5 minutes, 10 minutes.
And did we do that after we took the teeth out or before?
After, yes.
So in some cases, now that we do this more often, we would do it before we took the teeth out so that we knew what we were aiming for. But you did do well because you wore a denture for a good 2 years, didn't you?
Yes.
So we took out most of your, all of your upper teeth, most of your lower teeth, gave you a denture, and we had to do loads of rebuilding with the bone.
Yes.
So how painful was that?
It was, Neil, but you just look, you're waiting for the end result, aren't you? So you have to go through with it, like no pain, no gain.
So we've talked about that it was uncomfortable, it was a long journey. What was the most uncomfortable part, do you think?
The denture, taking the denture out. You know, after I've had the teeth removed and had to wait a day, it's as if it's stuck, and the soreness of pulling that.
Yeah, it doesn't help then when the stitches that it sticks to, because you have to wear glue, don't you? And
Yes,
it doesn't help
But I was afraid because I did suffer dry socket before.
Okay.
And you put an end to that because you took some blood, didn't you? And
that's right.
Filled the sockets up and stitched them. I didn't have no pain.
So we take some blood, we spin it in a centrifuge, we separate out the platelets and growth factors that we can then put back into the sockets to stimulate healing. And it worked very well, didn't it?
You did, excellent.
So we took the teeth out, we gave you a denture, we got the appearance correct in the denture, didn't we, before we started?
Perfect.
Because at first we made a few changes to how it looked.
That's right.
And then we rebuilt the bone, we had to lift the sinuses up.
Yes.
Was that about it? I know you were worried about it. Was
Piece
that
of cake really now when I look,
Good.
I don't think whatever you did to me, Neil, I suffered too much, to be honest.
And how did you cope with the sedation? Was that a good thing?
Oh, the best thing ever. I wouldn't have done it without sedation.
Because you don't really remember, do you?
No, didn't know anything about it.
Good. So then we came to putting the implants in, and that's not too big a deal then, I imagine. That wasn't, you're building then, aren't you? So it's a good feeling.
Yes.
So when we put the teeth in, we put the temporaries in first.
Yes.
Did you like them straight away, or was there a learning curve, or was there a getting used to them?
I didn't have to get used to them. They were just like normal teeth.
But it was useful, wasn't it? Because there was a couple of teeth you didn't like the appearance of.
Yeah, just the one, wasn't it?
That's right.
Yeah.
So that allowed us then in the final
Then
ones.
you put that right for me, didn't you? I love them.
Good.
Absolutely love.
But you spent a lot of money. Was it worth it?
Yes. Just to feel confident and happy again, it's worth it.
Good.
Yeah, definitely.
So, at the end, you've finished, you're happy, you can chew, you can smile, no pain.
No.
Somebody else wants to start this journey, and it is a long journey. What would you say to them?
I'd say be patient, stick with it, but only use this practice here, because the expertise is second to none. You're perfect. Absolutely perfect.
Wonderful. Well, it's been a pleasure looking after you.
Thank you.
And I'm so pleased that you're happy with the result. It'd be nice if it could be done much quicker, but things take time to heal in between, don't
Of
they?
course, you did it the right way, Neil.
Brilliant. Well, thank you very much indeed.
Everywhere.
It's been wonderful. Thank you.
Okay.